If you want to get your first nursing job in pediatrics, I have a few tips for you. This is coming from me, Jeannie. I'm a nursing career coach and I'm also a pediatric nurse manager. First tip is if you can get any work experience in pediatrics, whether that's in the hospital, whether that's just working with children in general, maybe it's a home health aide, maybe it's a nanny, do that. If you can't get a job in peds, I highly recommend doing volunteer work at your hospital, working with pediatric patients. That will really show your incentive, your proactiveness, and your passion for the specialty. I know in nursing school you don't always get a lot of say about where you do your clinicals, and usually pediatrics is a specialty you get the least amount of time in. So if you can do your preceptorship in peds, that is gold. Next tip is using your network, being proactive, and reaching out to leaders in the specialty. If you're doing your clinicals at a hospital, even if you are not doing it on that pediatric unit, use your resources and connections to try and figure out who the hiring leaders are for those pediatric departments so that you can try and reach out and make connections. And finally, be clear on your why for why you want to be in pediatrics and be able to articulate that clearly, particularly on your cover letter and your interview. Peds tends to be a really competitive specialty to start in. A lot of times you have to go through a new grad residency program and there's really high volumes of applicants. So you want to have a standout application between your resume and your cover letter. And you also want to interview really well. If you're having a really hard time landing a job in peds right after nursing school, there's nothing wrong with starting in adult and gaining different skills and experiences there and then transferring over to a pediatric unit later on.